I had the pleasure of speaking with Dr. Gisela Orozco, who's been speaking in the drug repurposing session. Thank you for speaking to us, Dr. Orozco. It's a pleasure to have you. So I'll just start off by asking you, could you tell us a bit about your talk and what you've been discussing in it?
Sure. So my talk was about how we can use genetics and genomics data to inform drug repurposing in rheumatology, which is, as you know, a very important unmet clinical need for these patients.
And just to get an idea of what used to happen in the past with genetics and using the techniques to perhaps focus on drug repurposing?
Well, 10, 15 years ago, the field of genetics was revolutionized by genome-wide association studies, and these have been applied very successfully to identify many genetic risk loci that contain variants that are correlated with an increased risk of disease. And these variants, a proportion of them, map to genes that are actually targets for drugs. And this data can also be used to repurpose drugs. So, for example, associations with components of the IL-23 pathway has sparked the repositioning of some drugs that target this pathway in psoriatic arthritis, for example. But there are a few successful examples, but really the full potential of GWAS for clinical benefit has not been realized yet.
Yeah, there's lots of interest in genetics now with newer techniques that are coming to the forefront. Could you just tell us briefly about the newer genetic techniques and how perhaps they might help us with this drug repurposing target that we've got?
Yeah, so there's a lot of promise around functional genomics because it's difficult to interpret functionally what these GWAS variants do because they do not map to genes. So with functional genomics, like looking at chromatin interactions to see what genes these variants may have an impact on, we can better refine these GWAS signals and functionally interpret them. So hopefully with this new information, we can help further in drug repurposing.
Yeah, that's great. I know there are some really good talks, particularly focusing on genetic techniques at the Congress. There's a talk on JIA coming up, so we'll all be looking forward to hearing about that. But thank you for.
Thank you. A pleasure.